Morning, madam. Good morning, Divya madam.
Sir, with your permission, shall I start the program, sir? Very good morning to the respected dignitaries, our principal, sir, respected vice principals, all respected staffs and dear students. I welcome you all to the today's Student Professional Development Webinar. It is organized by Faculty of Pharmacy, Dr. MGR Educational and Research Institute, in association with International Institute of Health Management Research, Delhi. So on behalf of Faculty of Pharmacy, Dr. MGR Educational Research Institute, I take this opportunity to express our heartfelt thanks to our Honorable President, sir, and Honorable Secretary, sir, and respected Vice Chancellor, Madam, for the constant support and guidance. Faculty of Pharmacy, Dr. MGR Educational Research Institute, has been successfully organizing series of national and international webinars, faculty development programs with eminent speakers from all over the globe with a vision to strengthen the scholarly wealth to the student professionals to gather the knowledge of healthcare industry. So let's be. I'd like to call upon our respected Vice Principal, Dr. S, to deliver the welcome address. Please, sir.
Thank you, Madam. Respected Principal, speakers, dignitaries, beloved faculty members, students, and participants, good morning to all. I'm very glad to welcome you all to Student Professional Development Webinar on the topic Future Prospects and Management of Healthcare Industry in India, organized by Faculty of Pharmacy, Dr. MGR Educational Research Institute, in association with International Institute of Health Management Research, Delhi. At this moment, I would like to extend my heartfelt gratitude to our Founder Chancellor, Dr. A.C. Shanmugam sir, Honorable President, Engineer Thiru A.C.S. Arun Kumar sir, and our Honorable Secretary, Thiru A. Ravi Kumar sir, whose continuous support and motivation is helping us to transform our efforts to successful reality. I take the opportunity to thank Professor Dr. S. Geeta Lakshmi, respected Vice Chancellor, for her guidance and support. I'm indeed glad to welcome Dr. N. Harikrishnan, our beloved principal, who wish to bring all the good things to our students and continuously working towards their betterment and improve their proficiency. I also welcome and extend my gratitude to Dr. Anandi Ramchandran, Associate Professor, and Ms. Divya Agarwal, Associate Dean and Assistant Professor from International Institute of Health Management Research, Delhi, who willingly accepted our invitation to share their expertise and knowledge. Healthcare is one of the most vibrant industries, and it includes vast areas, including hospitals, clinical trials, medical devices, equipment, health insurance, and medical tourism. Healthcare industry is growing at a tremendous pace, owing to its strengthening coverage, services, and increasing expenditure by public as well as private investors. According to India Brand Equity Foundation, during 2008 to 2020, the healthcare market is expected to record a 16.5% growth, and total industry size is expected to touch $280 billion by 2020. Hence, the concept of healthcare management has totally changed in context of global scenario, and it has not remained limited to merely the medical staff now, but has rather extended beyond the hospitals with the amalgamations of sectors that provide goods and services related to preventive, rehabilitation, and palliative care. In addition to the doctors and other paramedical staff, the healthcare industry looks forward to competent and specialized healthcare management professionals who have a handful of knowledge to handle the administrative and management needs well. So today's webinar would help us to understand more on the future prospects and management of healthcare industry in India. With that note, I once again welcome all the participants to the Students Professional Development webinar and wish everyone a very great learning experience. Thank you all.
Thank you,
Over
sir.
to Stella, madam.
Thank you, sir. Now I request our Assistant Professor Dr. B. Geeta, madam, to introduce our respected speaker, Dr. Anandi Ramachandra, madam, Associate Professor, International Institute of Health Management Research, Delhi. Please, ma'am.
Thank you, ma'am. It's my privilege to introduce the speaker, Dr. Anandi Ramachandran, ma'am. So, Dr. Anandi Ramachandran, ma'am, has more than 2 decades of combined experience in academics, industry, and research in the areas of healthcare, informatics, and information technology. She has a doctorate from University of Madras and postdoctoral research experience from Department of Civil Engineering, IIT, Madras, and Lab of Membrane Biophysics and Biochemistry, National Institute of Health, USA. She has been trained in bioinformatics by WHO, PDR through training fellowship. She worked as an associate professor in IIHMR and coordinates all institute health information technology activities in academics, training, and research. She is also a director for the Fellowship Management Program and nodal faculty for Center of Entrepreneurship and Innovation, IIHMR, Delhi. She has strong experience in design implementation of projects related to health information technology, coupled with insightful experience of serving as functional architect and product manager for the development of medical and healthcare software products. So she has served as an expert panel review member for DST and government projects related to technology in healthcare. She is a committee member of HIMSS India Education Chapter and International Society for Telemedicine and E-Health. So Dr. Anand is also a technical consultant for SATH, SATI, IMMCI organizations which are working in telemedicine. So she teaches subject related to requirements gathering, designing, evaluation, bioinformatics, and digital health to the postgraduate students of Health and Hospital Management and Executive Program in the IIHMR Delhi. She has also provided a number of training workshops in Delhi health for the working professionals. She has been invited to give lectures in many colleges and a panelist in webinars. Throughout her career, she has supervised and guided more than 100 plus students towards their dissertation and thesis submissions. So Dr. Anandi research, ma'am, interests include public health informatics, understandings the barriers and challenges in digital adoption, evaluation of technology in healthcare, health data analytics, and utilization of tools like GIS, mobile technology, and social network analysis in health research for risk prediction, disease monitoring, and health promotion. She has published many articles in reputed journals and she is a reviewer of many international journals. So without delay, I want to welcome Anandi ma'am to give her valuable inputs on the topic future prospects and management of healthcare industry in India. Thank you, ma'am. I welcome you, Anandi ma'am.
Thank you all from MGR University for inviting us. And Dr. Geeta, I hope I have to, keep up with all the things you have been going about me. There are a lot of things which I am also not aware. Thank you very much. And Dr. Satyamurthy, you had given us a very good start. I think so we don't need even any presentations. We could just start straight interactions with the students. So with much ado, so let me start today. I'll give you a brief about what healthcare industry is about. And rightly said by Dr. Satyamurthy, the opportunities are more. The healthcare industry is not like we were all seeing traditionally, where it was only, depending upon the shoulders of their doctors and nurses and the pharmacists. They had a definite role to play. Now you can see it is a diverse field where a lot of people are involved. It is no more just clinical oriented. It involves management also. Plus, everywhere digital technologies are there. So all these put together, the one can say the way the industry is looking towards people are those with diverse skills, with various, knowledge from different, you can say master of all trades, jack of none. That's accepted nowadays. Okay. So you don't need to be very much too specialized in one thing. You need to have an idea of what is happening. And so we from IHMR today would like to give you a short overview of what are the prospects of, especially management in healthcare industry, because management traditionally, when we think about MBA. Okay, people are doing HR, finance. Yes, that is still there. You do need it. That's not gone anywhere. But healthcare is something which we were thinking, from the perspective of hospitals, or from the perspective of drug companies, pharmaceuticals, right? But now that's a little bit changed. Now we are having an amalgamation of management and healthcare. So let us see what it is about. Next slide, please. Now, I would just like to ask you all a question. Anyone can feel free to answer. I want this answer from the students. As Madam said, Geeta Madam said, yes, I am a pure academician also. So I believe in getting answers from the students. Do you people feel really that health status of our country is actually changing? Or after 75 years, we even recently celebrated our Republic Day. So what do you feel? Is there a change in the health status? You need to answer, otherwise I cannot go further. Someone should answer. Hope I'm not going fast. So you can stop me if you feel I'm going very fast. I can talk slowly. But being a South Indian, you all know, you should be able to keep up with me fast. So can anyone tell me, do you feel that the health status of our country, people, our population, is it really changing or no? If you feel no, why? Why do you feel so? If you feel yes, then we'd like to take a answer. Do you feel it is becoming better, or it's safe, not much changes, nothing has happened during the 75, or is it going to worse? Time starts now. Anyone? Or I'm just going to call by name.
Do like that, Anandi madam.
Pardon, you can even, pardon, I'm not able to hear it clearly.
Students actually, they never interact. I don't know what to do.
Sir, that is the, you can say, the curse of online teaching.
Please.
We fight with it. We fight with it every day. Though we say blended learning is good, but this is one. Anyway, it's okay. Next slide, please. Yes, we do. There is a betterment. In fact, there is a betterment in healthcare. Yes, but we have not reached the stage, because if it has everything is better, what is the necessary for going from MDG goals to SDG goals and all those things, right? Yes, the status is improving, but for example, recent COVID also taught us things can happen. Anything can happen in the, by the providence. You call it providence, you call it environment, you call it nature, whatever you want. The more we prepare, the more we try to go forward, something always happens to take us a little bit back. But still, considering at the what stage we were during our independence and where are we now, you will see that there is a lot of development and improvement in the health status as far as health status is concerned. And especially students, you from Chennai, you have definitely need to an answer to this, because you should be proud. Tamil Nadu is considered to be one of the states with good health indicators. Whatever government might come and go, there are two things which they don't touch. One is health and one is our education. So you should be proud and start giving answers related to that. Okay. But any health scenario of any country, especially developing countries like our India, there are major factors which affect the way the health scenario changes in the country. It is the demographic shift, how the disease epidemiology changes, how new diseases come and go, and then rapid urbanization. People start shifting from from the rural to the urban side, and even the rural area is slowly getting converted to a lot of like a semi-urban stage where all our fields and everything are gone. And then yes, economic development, how the economy of the country, the GDP is there, and then political agenda. Now we also have one more major pillar which is affecting the way that we had foreseen, the healthcare industry. Gone are the healthcare industry of the olden days when our grandfathers and great grandfathers were there. Traditional healers and doctors, everything that's gone. Now we are having our technology breakthroughs, lot of innovations in the form of big data, artificial intelligence, machinization, AR, VR, and now we are having a mixed reality present inside. You can go on and on with 5G bandwidth. So lot of development as far as technology is coming into play. Next slide, please. Especially if you see in the demographic shifts, two major things. Demographic shifts, if you look into that, elderly populations are increasing. Yes, COVID took away, our elderly population more than the youngsters in the second wave. But still, those people, those who are now in middle age, somewhere around 50, in the age of 50, people like me, within few years down the years, we are all going to become old. So the elderly population is definitely increasing in our country. Then if you see, the life expectancy has changed a lot from 1990, where the expectation, the life we expected was somewhere 40, 45, 50 like that. If you see after 2000, the expected years has increased. Latest in 2019, which is actually according to a report by WHO, we are somewhere on an average of 70 years, right? So life expectancy is increasing. Okay, then next slide, please. The disease epidemiology is changing. The way the various diseases are there. We are having communicable. Previously, we had an issue of only infectious diseases. Then started coming in non-communicable diseases. Now, adding to all those things, we start having, the deaths due to injuries, road injuries, violence, everything. And we thought we have taken care of certain diseases. They are making a comeback again, right? TB and all, we thought we had removed them, but no, they are coming back. And we also saw now the recent COVID is a very good example for so many things. It has also showed us how our immunity is so less. Even if, especially people with a double burden, if they are already having certain other comorbidity in them, if they are having a diabetes, CVD, kidney, they are more prone to even a small any infectious disease coming and affecting us. Even it might be cold, right? And added to that, one thing which we have not mentioned here, the other factor is our pollution and all that is happening throughout in the country. We are one of the polluted countries of the world. So all these things are changing the way the disease epidemiology is changing in our country. Next slide, please. This slide is actually showing you in detail a little bit about how the communicable, maternal, neonatal, and nutritional diseases are distributed in our country. Next slide. Now, when we're talking about the health sector, now, why are these things important? Why do you, let me diverge a little bit here in the slide. We were talking so far that, demographic factor is very important. Disease epidemiology is affecting the health sector. Technology is affecting the health sector. Our policies, the way we are having our investments, all these are affecting. Now, how do they affect the health status of the people? With change in demography, for example, let me take about the elderly care. You mean there are increase in the elderly care, providing care to elderly persons. It is not a single day affair. Providing treatment for NCD and managing it, it is not a 1 day or 3 day affair like a cold. Even this COVID showed us it is not just a matter of 5 days or 7 days the COVID was there, it went. No, we are having after effects even later too. So you need lot of time, lot of people who could, take care, provide care to the people for all those, whether they are geriatric, whether it is for NCD, right? And if people are moving, let me say, from all rural area to the urban area, right? Then what is happening? Even the medical doctors, you know it very well, healthcare professionals, they also like to stay in a place where there's more opportunity. So people prefer to stay more in an urban area, which what happened? There is a lack of healthcare services available in the rural area. There is a divide. Okay. So all these things indicate that we have to bridge the gap of the healthcare infrastructure, healthcare services, healthcare professionals, which are, which is very predominant in our country. Even according to a WHO, for example, the number of nurses, the number of doctors, right? We are very much less compared to what has been expected as a standard by WHO. And also you should consider that our population is also, even though people believe that the population has gone down, but it is expected to reach its peak, say by 2045. So we have to be prepared for all these things. So when we're talking about an healthcare sector, as we had mentioned earlier, is not just hospitals. It involves, medical devices, clinical trials, having clinical trials done. Then nowadays, the recent telemedicine, providing care to the people remotely, then medical tourism, then health insurance, name it, pharmacy, right? And we are also having home health care services. People are nowadays, because it is becoming very costly to keep people for longer time in the hospitals. So people are trying to provide, unless otherwise they are not very serious or they are not keeping them in ICU. People prefer to keep them at home and provide healthcare services, monitoring at home. So that is also has started picking up. So all these things are components of healthcare sector, and more especially, you would have heard a lot of reports that a lot of medical violences are happening throughout. It doesn't matter whether it is in a Bihar, whether it is in Calcutta, no state, has escaped from this. The reason, especially during COVID and all those times, the reason being those services, because the professionals are, there is a gap in the number of professionals, in the number of services, number of beds, everything available in a hospital. And if you look from the patient's perspective, patient's family's perspective, they are trying to save their member, their own kith and kin. So what is happening there? Lot of stress, and it is leading to violence. One of the main reasons is that these services are not managed properly. We do not have, doctors cannot keep doing managing things, right? It is not their job. It is not they are not there to look after all those things. So there is a lack of health and hospital management. So that is another important component of healthcare sector. How all the services can take place, how the patients can be managed. Okay, next PPT, please. Now, is it really important as far as a country is concerned? Definitely. Globally also, the healthcare sector industry is growing fast. And in India also, the healthcare sector industry is growing very fast. Lot of investments are happening. Many mergers are happening. Small hospitals are being merged together to form a big corporate hospitals, and hospitals are forming chains, even in the 2-tier, 3-tier. Government is also coming up with lot of initiatives for that. There is a lot of investment, and overall we are expecting the healthcare industry to reach to $372 billion by the end of 2022. Next, please. And medical tourism. Okay, past 2 years we were not able to see much of medical tourism due to travel restrictions. But this will come back, because India is well known not only to provide quality services, also the cost of the healthcare services here in our country is less compared to certain rich countries, developed countries, right? And because the quality of the service is also very good, people, those who are underdeveloped countries, they also prefer to come to our India. So the Indian medical tourism is expected to grow on year-to-year basis. Okay, this was a a little older data because of COVID. People have not come up with the new data, but we are expecting it to grow more than as it was before. Health insurance is definitely gaining a momentum, and then hospitals and diagnostic centers are also been attracting a lot of FDI, okay, in our country. Many foreign companies, drug companies, pharmaceutical companies, hospitals, they are all branching out in our country, and they are investing in the smaller countries in our the what you can say in our country. Next, please. Right. The private hospitals are also growing faster. The market share of the private hospitals is expected to increase by the end of 2022. Right. We are expecting that it will reach to $132 approximately, but this might change a little bit more. And with the more private hospitals coming up in rural healthcare, this data can go, it can explode like the thing. Next slide, please. Now, from government's perspective, so far we were seeing private organizations. We are telling private is investing, they are investing here, they are branching out there, they are entering into digital world. But what about from the government side? Government is also, not far behind. You would have known that we started with Niti Aayog health initiatives, and then we had our Ayushman Bharat launched by the government in 2017, where under which the Health and Wellness Center and PMJY, this one scheme started coming up. So secondary and tertiary level cares have all started being given a lot of motivation and incentives, and now the recent Ayushman Bharat Digital Health Mission objectives, to bring in all the health information of the population, not only in the digitalized way, it should also be shared between various healthcare providers and the community. From the access to the health services should increase a lot, so that the people get to know about what are the various health services are available, who are the providers, where they are present, right? So that is why that unique health ID is also coming into play. Next slide. So what are we expecting, in Indian healthcare post-COVID? Let us say COVID has gone. We expect that within next month or so, or at the most 2 months, let us be on the positive side, that it will leave our country and go, right? Touch wood, we hope we do not get in new other strains. But you should remember, because of COVID, there has been a lot of financial losses, okay? Even in the healthcare industry, smaller clinics, they have not been able to open up, right? Small, you can say, because only mostly we could say online companies which have been providing medicines and drugs, they have been making a lot of profit, right? Otherwise, there has been a lot of financial losses. And then even health workforce, many have died. Many have lost their close of, they have lost their jobs. Then many have mentally been affected due to stress. They have also lost their family, and they have seen patients dying in their hand. So there is also a lot of staff shortages are also there, right? And the quality we have seen, with technology coming into play, and lot of you can say medical errors coming up. So you need to improve the quality, you need to remedy the staff shortages. Then, as I mentioned earlier, there is a lot of digital technology which is being introduced everywhere, starting with the keeping up of the medical records of the patients in the digitalized format, using artificial. Everybody is talking about artificial intelligence. Everybody is talking about big data. Actually, what are they doing in big data? Though it might not be clear, but the idea is, what is the basic idea? Make use of the existing data for prevention, for prediction, right? For treatment. And it also needs to be a participatory. Nowadays, we are talking about participatory medicine and also personalized medicine. So all those things, to achieve that, digital technology is being used. And more important, the technology should be used for increasing the communication and coordination with the patients. That is also another focus. And this is also one more change which has happened and we are expecting it will continue post-COVID. Then data, as I had mentioned, for prediction, prevention, treatment, etc. Then another area which has been given more importance nowadays is the behavioral sciences and home healthcare services, right? So, and then health technology assessment, because a lot of medical devices are into play. Then pharmacovigilance, medical reconciliations. These are some of the areas which are being given impetus by the healthcare industry. Now, our recent union budget is also focusing on improving digital health infrastructure, and it has given importance to mental health, and then increasing the quality and the infrastructure present in an Anganwadi, which was initiated by the Niti Aayog, and then nutritional. So we are come up with a version of Portion 2.0, and then the health expenditure has also increased to 13%. Next. So what do we mean? So what does this mean, all those things? This is generally about the healthcare sector. For doing all those things, we need health managers. Why? Look into the data. Even by 2025, we need 3 million beds. We need 1.54 million doctors. We need 2.4 million nurses. And then we need more investment of $86 billion. Do you think so? It is really possible to do all those things within the next matter of next 3 years? Definitely not. Even if you start building hospitals and in every village, every city, every town, in every street, let me say, right? But where is the staff, right? Where are the doctors? Where are the nurses? So, and that becomes very difficult. So one way for us to do it is use the existing services, but manage it properly, monitor it properly, manage it properly, and utilize it properly. And who can do that? We need people, those who are dedicated managers, those who are having the domain knowledge, and they can also manage such operations, whether it is in hospital, whether it is in public health, whether you're talking about NGO, whether you're talking in a charity, wherever you want, you need to have managers who could take care of all those things. And with this, next slide, please. Okay. Now I'll request Ms. Divya to continue from here, what we do in our IHMR and how and what are the opportunities available for you as a pharmacy students. Over to you, Divya.
Thank you, Dr. Anandi.
Thank you, ma'am. Ma'am, thank you for your valuable talk and knowledge share, ma'am, about the healthcare industry. I just want to inform that we have streaming the presentations in the college classroom, so the students are watching directly. And may I request our principal, sir, to convey few words, sir? Please, sir. Sir, your mic is in mute, sir.
So good morning, madam. So first of all, I would like to sincere thanks to on behalf of Faculty of Pharmacy and the management. My sincere thanks to Honorable Ramachandran and the other one showing interest to take the healthcare professions. So as rightly pointed out, Honorable Ramachandran madam. So many opportunities it is there in the healthcare profession. So nowadays, about relevant to the population, even healthcare people and the health sectors also it is going well. But the people, the students actually cannot much explore. Not much explore. They keep they are expecting only one profile and not other sides. But the health sectors, it is widely opportunities is available. the people are not showing much interest to such jobs. They're standing in the one place. They want to come job into the place. They're expecting like this. And also the students, madam, actually they're expecting initially they want to get, more salary. The qualification may be less. They're expecting today itself I want to grow. But as my point, a little bit if you show the patience, so definitely you may get it. The patience is mandatory to the students. Always, even I'm insisting my students also. Please please stay with the one place at least a year. So there is a growth. But now the current generation, within a year, 3, 4 companies may be shifting, and finally you may start somewhere. That means it shows degrowth. Completely it is degrowth. There is no patience. So as rightly pointed out, wide number of jobs in the health sectors nowadays compared to last 5 years. Even madam, health sectors is coming out from 2020 March. Who is health sectors who are working, and what is pharmacy profession, what is nursing, and what is physiotherapy? Because during the COVID season, so definitely, completely it is focusing how the health process is growing more. As rightly pointed out, Anandi madam, during the COVID, the GDP, all the sectors maybe is coming down, but only health sectors is showing growth, a lot of growth, even during the COVID period. Even during the COVID period. So even I'm keep insisting, and again I want to bring notice all the students, whoever we join here. So please keep patience and show the patience. So definitely your growth, nobody is not prevent your growth. So please look around the health sector jobs. So please explore the many jobs as rightly pointed out, the hospital as well as industry, and many sectors it is growing well. Please show your interest towards all the sectors and do your jobs and show the patience. So that is my information to all the students. And thank you very much, madam, showing much interest towards the health sectors and showing a lot of information about the health sector's growth with the data. Thank you very much on behalf of Faculty of Pharmacy and our team. So thank you very much. Thank you, madam.
Thank you, sir.
Thank you, sir. Just before leaving, your questions, sir, will be addressed by my colleague. You had certain questions. The students want to keep, jumping, and they want salary, everything. So because being a dean, associate dean, taking care of admissions and everything, being involved in placement, now she will give you a good idea of what is happening.
Thank you, madam.
Thank you, sir. Yeah.
Okay. So now I request our principal sir to felicitate our speaker, Dr. Anandi Ramachandran madam, of today's program with the e-certificate as a token of honor and request. Please accept our e-certificate as a token of honor and respect, ma'am.
Thank you, madam. Thank you.
Thank you all. Thank you all.
Thank you, sir. So may I now request our assistant professor, Mrs. M. Devi madam, to introduce our respected speaker, Ms. Divya Agarwal madam, Associate Dean and Assistant Professor of International Institute of Health Management Research, Delhi. Please, ma'am.
Thank you, ma'am. Good morning, everyone. I feel very happy to introduce today's eminent speaker, Professor Divya Agarwal, Associate Dean, Admissions and Accreditations on behalf of Faculty of Pharmacy in this juncture. Professor Divya Agarwal has graduated from Delhi University in the field of instrumentation. After that, she did her MBA specializing in human resources and finance from Guru Gobind Singh Indraprastha University, Delhi. She has more than 18 years of academic and consultancy experience and has diverse knowledge of corporate world. And she is an expert on long-term success. For the past decade, she devoted her energy to investigation of long-living corporations, like how they grow, adapt, and consistently beat their competitors. Under her supervision, 9 postgraduate students carried out research work in the area of zoonosis, which was funded by international organization. She had carried out research project on workload assessment of ANMS funded by UNICEF and has carried out various projects related to strategy and HR, wise strategy evaluation, workforce planning, competency mapping, talent retention strategies at the corporate level. She has conducted various training and workshops on areas related to organizational behavior in various organizations and B schools. Besides this, Madam has written various research papers in the Journal of National and International. I request Professor Divya Agarwal, Madam, to grace this occasion. Welcome you, ma'am.
Thank you so much, Devi ma'am, for the wonderful introduction. Right? And I would like to tell all the faculty and beloved students that apart from working into the education domain, for next 6 years, I have worked with Bharati Airtel, where I was handling the HR issues as well as the conflict and the grievances of labor and the workforce of that particular organization. Right. So to not to take much more time, I would like to now focus upon what Dr. Anandi has spoken about, the opportunities, the kind of growth that you can see into the healthcare domain, and how IHMR Delhi is contributing, making a major contribution towards the growth of the health sector of India. Right. So let me just share the screen. So I'll do it into the slideshow mode. Yeah, so to tell you about International Institute of Health Management Research, basically we are a part of IHMR Society, right? And we have a foundation in Delhi in year 2008. And it has basically, we have a focus on the national and international health, where we are catering to the growing needs of the country, of our own country, as well as the countries in the Asia Pacific region. Right, so we are majorly contributing into the areas of research or in evidence generation. And when we do the evidence generation, that helps the policy makers in formulating the health policies of India. They devise these strategies and they are implementing these policies into the various health domains of different states. As well as IHMR is also focusing on the strengthening the capacity building of the professionals or those people who are belonging to the healthcare sector. So I will tell you what are the major activities in which IHMR Delhi is involved. So we are basically into three domains. The first and the foremost domain of IHMR Delhi is into academics, where we are running a 2-year full-time postgraduate program in hospital and health management. To bring it to the forum, to bring it to the audience, I would like to tell that IHMR has a legacy. They are the pioneer institution who have launched such type of course in India, understanding the management issues being crippled at the block level, at the district level of various states. So we launched this program in 1996. Now, the second area in which we run our academic program is for the working professionals. So that is a 10 months executive program of hospital management, where the people who would like to understand how to manage their day-to-day operations in the hospital scenario, we give them a plethora of knowledge and experience and the experts they share how they can manage or deal with their day-to-day problems in the hospital settings. So basically we do this course on the weekend, and we run this course in the weekend, and Saturday, Sundays we have classes for these working professionals. Recently, in the last year, we realized that there are many professionals, there are healthcare professionals who would like to pursue or hone up their research skills. So we introduced a 3-year fellowship program in management, for which Dr. Anandi is the course director, and we are focusing in the research domains of hospital management, health management, and health information technology. I will tell you in my next slide what are these three domains. Now, the second activity of IHMR Delhi is related to research. When I said that we are actively involved into the evidence generation, so our institution is contributing to the development of population policies, health policies, various strategies, program monitoring, evaluation, and we are contributing towards the generation of new knowledge. To tell you, we have an active team of the faculty and the research staff which are doing various projects related to the health domain, hospital domain, and health IT domain, and they are not only doing it for the national, but we are also doing the projects for the international agencies. The third domain, the third core activity of IHMR is into training. When I say training or when I say management development program, we are talking about strengthening the technical and managerial capacity of the health professional. So the people who are already working, who are already there into the health system, right? So year on year, they require the capacity building of their workforce. So what do? They choose IHMR as a destination where they feel they have an expertise. They nominate their people, like we get the people from different countries apart from India itself. Like in the Asia Pacific region, we get the participants from the Ministry of Health, from Maldives, from Bhutan, from Bangladesh, from Myanmar. They are regularly visiting our institution. They are getting capacitated in the areas of hospital management or areas related to management where we talk about leadership, team building, and when we are focusing upon the research aspects, the qualitative analysis workshops which are being conducted over here. Now, what makes IHMR among the best institutions? Why I said it's the pioneer institution, why it is the best institution. So here are the 5 pointers for you to understand. In my last slide also, I told you that we are the first one to start the health management program in 1984, where we focused upon we started with the training programs, and then slowly we thought of launching it as an academic program throughout India. And we are among the top 100 business schools. When I say top 100 business schools, we are there among other management schools which are just offering the courses or the specialization into the general management area. But we are an organization who is catering to a very specialized and niche sector, and we are among those top 100 B schools. Number one, in health management, since its inception, as we have got 3 campuses we have across India. One is in Delhi, another is in Jaipur, and the third one is in Bangalore. Then the fourth reason why IHMR is among the best institution is we have got more than 2,000 alumni who are right now working into the top positions in various public health or the hospital organizations, and they are leading it in a very excellent manner. Fifth one, because the students are enrolled in a postgraduate program, they have a focus with respect to the job opportunities. And if I say IHMR, since its inception, has been getting the students placed in the top-notch organizations related to hospital, health IT, and public health. Now, what are the advantages when I talk about the campus of IHMR in Delhi, right? So first thing is, the name itself says that we are an international institute of health management research. So what we do, we have, in my next slide, I'll show you that we have strategic partnerships with various international organizations whereby we need to match the international benchmarks and standards. So we try to incorporate such standards into the academic curriculum as well. As far as students' exposure are concerned, so how the students, they are getting benefit from IHMR Delhi campus, we have a plethora of renowned faculty with IHMR who have served in the UN organization and in different countries in Asia, in Europe, and US. As far as the experts into this particular domain are concerned, so all globally renowned experts, and they are serving in either government or international agencies which are available in Delhi itself. So whenever we want, we request them to come to our campus and interact with our young and bright minds. Third is the exposure to the international experts. When I said exposure to the international experts, you must have heard that many international public health experts, when they visit Delhi on some assignment, official assignment, right? So we try as far as when we come to know about them, we try to rope in and ask them or invite them to kindly come and address and share their knowledge and experience with our students. When I say Delhi, Delhi is a hub for the larger healthcare industry, right? So when we talk about leading hospitals, the IT industry, they are all based out of Delhi NCR. All ministries and the renowned institutions are there in Delhi because Delhi is the capital of India. It's the hub of many job opportunities for many young minds. The advantage, or one of the advantage when you do a postgraduate program into health and hospital management, we are the first institution to start a specialization into the area of health informatics. So Dr. Anandi Ramachandran is leading or heading this health IT department at IHMR Delhi, and it specifically is looking after the information technology aspects of the healthcare domain. Flexibility. When I said flexibility in academics, what does that mean? So every year we take the feedback from the industry and understand where these student skills are lacking, where additional knowledge or upgradation is required. So when we take that feedback, we try to incorporate into our academic curriculum and we keep on revising on modules. So a lot of flexibility is involved in our academics. And in my last slide also I said we have got excellent placement record till now. These are the partnerships that we have done with respect to the students' activities. So when I talk about these two hospitals, Emirates Hospitals and Raq Hospital, which are based out of UAE, these hospitals we have collaborated with them for the students' internships and the placements opportunity. Recently, one batch of our students, 2 or 3 days back, they have flown, they have gone to and they have joined Tumbe group of hospitals which is based in Dubai. The next picture which you can see, this is the Imperial College London, and we have collaborated with them. Why we have collaborated with them? We have collaborated in terms of the research activity. So the faculty from Imperial College and faculty from IHMR Delhi, they have collaborated and they are working and doing research into the areas of public health, like maternal and child health, right? So these are the areas where we are collaboratively working into the domains of research. The next picture on the right side, which you can see, is of the Mahidol University. It's a Bangkok, a Thailand-based university with which we have collaborated for student exchange and faculty exchange program, so that there is a cross-cultural learning of the health systems of both the countries. Plus, we have done many more partnerships with many recruiters with various healthcare organizations, where we see that students can get benefit, can get exposure in terms of amalgamating what they have learned in the classes with the real-time exposure to while working in these hospitals or these healthcare organizations. Now I'd say that we try to give exposure to research to our students. I must say, the moment you enter into IHMR Delhi, you start your journey with us, we try to imbibe research skills into the students. Right, so when we work, this is just a list where I have showcased that we have got various international and international partners with whom we work, like WHO, UNICEF, USAID, Oxfam India, Japaigo, Bill and Melinda Gates Foundation. In national agencies, we have got NHSRC, that is National Health System Resource Center. It is the think tank of Ministry of Health and Family Welfare. Then Department of Science and Technology, DST, IIPS, Alive and Thrive, PHFI, ICMR. So many of our faculty are involved into the ICMR project. And the areas where our research is focused is into the non-communicable diseases, maternal and child health, nutrition, urban health, climate change and human health. Zoonosis, where ma'am has introduced me that 9 students, they have worked into the area of zoonosis. That is, zoonosis is the disease transmission from animal to humans, right? So they have worked, they have developed the concepts, and they have carried out a research project, and they have published in a peer-reviewed journal as well. Then the other area of research is life skill assessment, large scale health surveys. For example, I have written LASI, LASI. LASI is Longitudinal Aging Study of India. As Dr. Anandi told you that we are going to witness the chunk of elderly population. So is India equipped to handle that kind of workforce? So for that, we have carried out a research in collaboration with the Harvard School of Public Health, where our faculty team was involved, and they have studied the elderly population health needs. Another area where we have worked is into the gender and health. So when I say exposure to the research, so when the faculty are doing or the research staff is doing the projects over here, we try to involve our students into these projects and give them real-time exposure, how actually research is being carried out. This is one of the picture where you can see the various delegates. They have come to IHMR Delhi campus for getting capacitated into the areas of hospital management or urban health management. So when I said about this particular program, where we specialize in, where we have a 2-year program, the first year is basically a foundation level year in which, because you all are coming from different backgrounds, we try to build your base into the health vertical, into the health domain, right? So when we make your base, so we introduce you the subjects of public health, of hospital domain, of health IT domain, plus because you are going to be managers, so we give you a flavor of what management is all about. So the management related subjects are also there. So in a way, you make a base towards the healthcare industry. And once the base is being made, you are being sent to respective healthcare facilities to get a hands-on exposure into the different operational aspects of the healthcare facilities. And once you return to the campus, you need to one of these specializations. It can be either health management, it can be hospital management, it can be health IT management. So when I talk about this first specialization, the hospital management, what actually it involves. So when I talk about hospital management, when you visit any hospital, you might have seen sometimes how smoothly things are being carried out. And when we have witnessed during the COVID-19 situation, the critical crisis of the bed and the bed management, then we talk about these management issues which the hospitals are facing. So you understand while doing this particular course from IHMR Delhi, you understand how to manage such nitty-gritties, right? Because we have the health workforce which are available with us, but we need the managers who can actually manage these facilities. So you can get placed into the corporate hospitals or the charitable hospitals or the government hospitals. And if I talk about, these are the few recruiters which we have showcased in our slide, which are regularly picking up only students of IHMR Delhi. Now, when we talk about the second specialization, that is the health management. So it basically focuses on the public health. That means serving the community or managing the community in a larger chunk, right? So when you say a public health, that means the national health programs, which are the focus of Government of India, how they are being managed at the block level, at the district level, at the state level and the national level. So they are being managed by these health managers who have specialized in public health domain. And the students who generally do their specialization, they get placed in the very reputed organizations like WHO, NHMs of respective states, NIHFW, that's the National Institute of Health and Family Welfare, international NGOs like CARE, then Japaigo is the affiliate of Johns Hopkins. So there are many organizations where the students, that if you can see into the picture, the students are also being recruited by various management consultancies. The third specialization, health information technology. So when I talk about health information technology, I would like to say it doesn't mean that you need to have a programming knowledge of the IT vertical, right? Basically what you will be doing, you will be acting as an interface between a doctor and a software programmer, right? You understand both the languages. You try understanding both the languages. Whenever a doctor faces any kind of issues or problems, they convey it to you, and in your own language, you convey the same to the software programmer who can develop the solution for the doctor. So when they are developing the solution, you are also involved with them. You give them the directions and specifications, how the problems have to be addressed. They come up with the solution, and ultimately you will show that solution to that respective physician or the healthcare workforce which are looking at or facing that kind of problem. So you help in the onboarding of the entire team towards the new solution, right? So it's where the students get generally placed when they are being specialized into the health IT domain. And as Dr. Anandi said, that right now the government focus is more on the digitization of the health records. There are ample and plethora of job opportunities into this particular specialization, and these are the various recruiters where our students are being getting placed over the years. And recently, if I talk about, many of our alumni and students are working with National Health Authority, and they are actively working towards this Ayushman Bharat digital mission. Now, as far as the job opportunities are concerned in this particular course, right, this is the chart which is explicitly showing you the kind of the placements that have taken place for the batch which has graduated in 2021, in the last year which has graduated. So what are the different sectors in which they are being absorbed? For example, 29% of the students, they have been absorbed by the hospital organization. Some students are not purely into hospital, but they are into the hospital services. Some students, they are working into the health IT services or consultancy firms, right? Some of the students, they are actively working into the public health domain. And if I talk about the packages being grabbed by the batch which has graduated last year, the highest package is being grabbed by a student who is working with Ernst & Young, right? And the student has been offered 15.85 lakh per annum. And the average package for the entire batch was 5.4 lakh. Now the admission, you wanted to understand how you get into this particular course. So the eligibility would be, you need to be a graduate with 50% marks during your graduation, right? And you need to clear, or you need to appear in one of the management aptitude exam like MAT, CAT, ZAT or ATMA, and your selection on this is just the eligibility. But once you apply for this particular course, you need to go through the process of selection, which involves the group discussion round and the interview round. As far as the course fee is concerned, the course is being offered at 7.4 lakh for the entire 2-year fee. And the students who are deserving, the students who have performed well during their graduation, for them we offer the attractive scholarships in which there might be waiver of 50% on their tuition fee for the first year. Now you being from the pharma background, the students from the pharma background, how do they actually fit into this particular course and how could they see that they could grab the job opportunities? So there are many pharmaceutical companies who are approaching our institution and they are looking for that kind of management aptitude, and the students who are from the pharma background, they are the best fit for that kind of analytics type of the job profile, right? And the healthcare leaders, they are realizing the importance of having pharmacists on their informatics team. And why they have realized the importance, the people who are from the pharmacist background, right? So they work along with the physicians and nurses, right, to achieve meaningful goals and develop and implement health IT systems. So the best combination that the student would see is from the pharma background with the health IT specialization. They can also a best fit for the insurance companies as well as in the hospital setups plus the healthcare IT companies. Right now, we have seen the students who are from the pharma background at IHMR Delhi, they are involved into the data analytics and data science for the drug research, right? And also in silico clinical trials, and they are being actively being demanded for the health technology assessments being carried out by government of India. So you can be a part of the policy formulations once you have got a decent level of understanding of the health systems. Now to know about the exam, the management aptitude exam, which you can appear, right? So the test, this is one of the slide where I have expressed what are the dates on which you can appear in the exam so that you can become eligible to apply for our course. Right, so this is all about IHMR Delhi, and this is all about the courses that we offer and what kind of opportunities are available to a pharma graduate who can explore this domain. And let me give you a brief understanding. No doubt you are from the pharma background, but ultimately once you reach the leadership position, if you want to aspire to reach to the leadership positions, you need to have an understanding of the management domain, right? I am not saying that without having a management degree you cannot reach the leadership position, but it will take a lot of time, right? The career trajectory is going to change entirely once you are from a particular background or for the pharma background, plus you have done a management degree, right? I would not recommend you to go for a management program which is a general management program. Go for your industry which is specifically focused for your needs. So opt for that program and it can open and you can be part of the policy or the health policies, or you can be part of the government systems as well, right? So that's all from my side. Thank you so much.
Thank you, madam. Thank you for knowledge share and valuable talk about the healthcare industry and career placement. Now I request our principal sir to felicitate our speaker.
Yes, yes, proceed, Dr. Stella, madam. So before that, actually, sir.
Yes. Yes, sir. So, felicitate our speaker. Okay, sir. So now I hand over the query session and vote of thanks to our assistant professor,
How many
Dr.
years?
E.
2 years course.
I think there is some
network issues. So,
Hello, Stella madam, voice கேக்குதா?
இல்ல சார் பிரேக் ஆயிடுச்சு சார். ஓகேங்க கேக்குது சார்.
Okay. So actually I have doubt actually. After so only 3 years program is the eligibility of this course, or maybe it's Bachelor of Pharmacy or diploma candidates can. Madam?
The diploma candidate,
See, actually, the eligibility of this course,
right?
eligibility of the course, maybe here, even diploma also we have B.Com 2 years course. Is
For
there,
the
is they eligible for this course or only Bachelor of Pharmacy or only for degree?
only the degree students, see if they are doing a diploma course in pharmacy, and along with that they are doing some graduation course from or a correspondence course from some other university, then they become eligible. So only thing is they need to be a graduate or they need to be into the final year of their graduation.
Okay. But really, it was pleasant, and the students maybe is a lot of information about the course and scope. So really, thank you very much, madam, about IM and the information. So really, I think my students also this is very useful, and they may be explore towards this. So thank you very much for sharing the lot of information so in this platform.
Thank you.
So in future, please keep in touch. In future also, we have good tie-up with IIHM. Thank you, madam. Thank you, both of you. Thank you.
So much, sir.
Thanks. So may I now request our principal sir to felicitate our speaker, Ms. Divya Agarwal ma'am, today's program with e-certificate as a token of honor and respect.
Please carry
Please
on, madam.
accept our e-certificate, ma'am.
Thank you, madam. Thank you very much for your
Okay.
valuable information. Hello.
Thank you, ma'am. May I now hand over the query session and vote of thanks to our assistant professor, Dr. Evelyn Sharon, ma'am.
Thank you, ma'am.
Please,
Thank you
ma'am.
so much.
Okay, ma'am.
Students, if you have any queries, kindly please unmute yourself one by one and you can ask your queries to the speakers. Students, if you have any queries, kindly unmute yourself and you can ask your queries to our beloved speakers. Yes, Tanisha? Please unmute yourself, Tanisha.
I think there are two participants.
Yes, ma'am. Tanisha?
Hi, ma'am. This is Tanisha. Good morning, ma'am.
Good morning, Tanisha.
Thank you for an eye-opening talk, ma'am. It was very great. We had a very great insight from you. So I have a small doubt regarding my project selection. Like, can I have an idea over government job fields after the course which you have offered here?
Okay, yeah, Tanisha, that many of our students see the students are also being absorbed by the government's health organizations like NHM, National Health Mission of respective states. So many of our students, when the opportunity or when they approach our campus, right? So the students, they sit for their placement rounds and get selected, and they are serving into the different states of India, and they are handling, not only they are handling the national health program. So let me give you a glimpse. When I talk about immunization program at the district or the block levels, right? So these students, the health managers, they are actively managing these health programs. Maybe they are involved into the immunization or leprosy eradication or during this vaccination program. So they are handling it from the government level, right? And they are being absorbed there as the district program managers or the district program coordinators for respective districts or the states, right? They also get selected into the job profiles of Ministry of Health and Family Welfare. They are working at the consultant levels, and they are working primarily into the area of human resources for health, maternal and child health, disaster management. These are the prime areas where the students are actively being involved into the government systems. I hope I served your answer, Tanisha.
Thank you, ma'am.
Thank you. I think Pooja, you can ask the question. Pooja ji.
Good afternoon, ma'am. I have a query to discuss. Can you please explain about higher education in abroad, ma'am?
Higher education abroad?
Yes, ma'am.
After doing this course?
Yes, ma'am.
Yes, if you are the Pooja, that depends. If you want to go to countries like US or Canada or UK, right? So every country has their own regulations, and when our course is internationally being recognized, right? So if you want to go outside, you just need to apply over there, and your reference check and your recommendation will go from our institution itself. So they send it, they will ask you the name of the people whom they would like to reach out, and in a way we get the request from these international agencies for the reference check. So you get an opportunity to work in these international organizations as well.
Okay. Thank you, ma'am.
Right. Thank you, Pooja. Yes, Shruti Nair.
Good afternoon, ma'am. Myself, Shruti from final year B Farm. Really, thank you for your open talk towards IIHMR, International Institute Health Management Research in Delhi. Being an upcoming pharma graduated, I have a basic clarification to know whether do we have an opening for students after completing UG as a fresher? Then what type of placement do we have, ma'am?
Okay. Dr. Anandji, would you like to answer this or should I address?
No issues. Okay. See, as we have said in our course, the mandatory for our MBA program is that you need to have completed your 3 years graduation. If you are in the last year and you are applying here, we expect you to submit your degree once you get it after the last year completion, right? Before the month of December of the particular year when you're taking the admission. And then the procedure Divya had already mentioned to you that we want you guys to have appeared. It is AICT norm that the candidate who's coming for an MBA program should have appeared in any of the graduation exams, MBA pro exams which are being conducted. It can be MAT, CAT, XMAT, anything like that. So how do we select your appearance? You should have appeared in those exams. Second, we have our own GD and PI, group discussion and PI. Based on that, we select you. Now, as far as the placement opportunities are concerned, remember once you're coming after you have done your graduations of pharma, B Pharma, right? You are having your domain knowledge of pharmacy with you. So what happens? You go to the position, even hospital and public health, whether it is healthcare IT, whether they are service providers or whether they are product creators, right? They also on, and then pharma companies. For example, Karkinos is one healthcare IT company which has been working in the area of cancer. So when they are working in the area of cancer, they are developing a software which is using artificial intelligence for prediction, for monitoring, and etc. So they need their students with pharma background also, right? And little bit of data analysis and technology. So they have taken an health IT student who had done a B Pharma, right, in their graduation. So the student has joined there. So your domain knowledge goes there when you're talking about healthcare IT specialization. Suppose if you have taken hospital specialization after joining pharma, you all know very well, or drug reconciliations, you need drug formularies, the people need you. And even in the hospital, they have their own IT team, right? And so they need, and especially electronic records are being maintained. So when you're going to talk about that, your domain knowledge comes into play. Your opportunities are similar to what the other students have, because this is a combined course where we have nurses, BDS doctors, MBBS doctors, pharma, even science graduates, right? Like biotech students. We have even BCA students, computer application students. Remember, once when you are coming here and you're going out, your job skill is, your opportunities are based for the fact that you have done your MBA program, plus the industry which is coming, the organization which is coming, they will look for the domain specification. For example, pharma is, it has been taking our students. So they try to prefer to take students those are having pharmacy background. Okay, so it's ZS consulting firm. What they do, they look for students those are having pharmacy background also, health IT background also, BC also. So the opportunities are more. Only thing is you have to see which job profile has been announced what is the opportunity which and where it has arisen, and where your skill set is appropriate. Okay, always the domain knowledge adds value to that.
And even the organizations like management consultancies like ZS Associates, it's a pure pharmaceutical knowledge management organization. And to bring it to the forum, this is the organization which always approaches IHMR Delhi for day zero placement. We have a placement week. They always book their slot, and they have a preference for the students who are from the pharma background.
If you look into our website, you will have an idea, the type of organizations which are coming to select students. So our pharma students, nursing students, so everybody, they do get placed. We have consulting firms, we have insurance companies, so we have hospitals, we have software development companies, right? So if they all come, the opportunities are there. Yes, MBA and your domain knowledge definitely adds value to that.
Yes, Tharun, you wanted to ask.
Tarun, please unmute.
Okay, thank you, ma'am. Thank you.
Tarun.
Yes, ma'am. Good afternoon, ma'am. I am Tarun Kumar from final year B Pharmacy. My ambition is to become a leading entrepreneur in pharmacy field. Can you please add your opinions to direct me for my future?
You want to become an entrepreneur? Welcome. We have a student who, after she completed this one, what you can say, 1 year or 2 years course. Then she just worked for a year in Access Digital Health, right? Remember, her specialization was in public health. You will be surprised. MBB doctor who took public health as specialization, but she got the opportunity in that organization. She got exposed to digital technology also. So now what she has done, within after a year, she has gone again and started her own company, right? So entrepreneurship, yes, we look forward to such students also, because the opportunities are there. And as we have mentioned, we also have an entrepreneurship and cell in our institute, so which also tries to provide you support for that. Okay, by bringing you in contact with the industry experts. Divya, can you add a little bit more?
Yeah, with respect to the entrepreneurship, Tharun, when you said you want to enter into the entrepreneurship domain, right? So first thing which you need to understand is how to start your organization. For that, you need the basic knowledge of the management, which you get over here in 2-year journey with IHMR. Once you have got the understanding of the management domain, I would not recommend you to straight away go for the entrepreneurial venture. First, you go into some organization and understand how things are being managed at the ground level. And then you make up your business plan. And yes, we have a pool of faculty who can actually help you in starting up your new organization related to, maybe you wanted to start up something related to pharmaceutical analytics or something like that. So you have a pharma background, we have a management knowledge. Dr. Anandi Ramachandran is into the analytics. We three together can combine and you can start with your entrepreneurial venture, right? So we have got that kind of flavor at IHMR Delhi, where the alumni who have already into the entrepreneurial venture, they also come and share their learnings, how they have started their different initiatives. I hope that serves your answer, Tharun.
Yes, ma'am. Thank you.
Thank you very much.
Students, any more queries? Students, if you have any queries, please do come forward.
Any queries in your mind where you feel you want more clarity, where you are, because I know in the final year, the students, they are in a confused state of mind where they would like to see whether they should go for their post-graduation of their respective field or they should enter into the management domain. Right, so feel free, we are here to address any kind of questions that you have in your mind.
Students, you have any more queries? Students, you have any more queries to be asked to our speakers? So, ma'am, then I will proceed with my vote of thanks. Thank you, students. Thank you for your questions, and thank you, speakers, for your valuable suggestions on them. Coming to the final part. Gratitude creates the most wonderful feeling. It can resolve disputes, it can strengthen friendships, and it can make us a better men and women. Thank you, ma'am. Thank you, Anandi, ma'am, and thank you, Divya, ma'am, for the thoughtful presentation. Honorable Principal, sir, esteemed speakers, faculties, and students. It is my privilege to have been asked to propose a vote of thanks on this beautiful occasion. First and foremost, I thank our special speakers, Dr. Anandi Ramachandran, ma'am, Associate Professor, International Institute of Health Management Research, Delhi, and Ms. Divya Agarwal, ma'am, Associate Dean, Admissions and Accreditations, Assistant Professor, International Institute of Health Management Research, Delhi. Thank you, ma'am, both of you, for sharing us with some of the finest management practices so that our students can be benefited by it. We are always in debt to express our special thanks to our founder Chancellor, Dr. A.C.S. Shanmugam, sir, Honorable President, Dr. S. Arun Kumar, sir, Honorable Secretary, Thiru A. Ravi Kumar, sir, for their constant encouragement, being the inspiring role models and strengthening us in all the educational activities. Our sincere thanks to our Vice Chancellor, Dr. S. Geeta Lakshmi, ma'am, for her valuable time, concern, and constant appreciation in our works, which heighten up our spirits in all the time. As the saying goes by John C. Maxwell, leadership is not about titles, positions, or flowcharts. It's about one life influencing another. My heartfelt thanks to Principal Sir for his valuable contribution, guidance, and encouragement in all our efforts. Thank you very much, sir. On this note, I would like to conclude my speech and hope that this day would have enlightened you all. Participants, thank you for staying. And thank you so much for all your queries. Hope to see you all in another event. Thank you, ma'am.
Thank you so much. On behalf of IHMR Delhi, we would like to express our sincere thanks to the entire team and for the Faculty of Pharmacy, Dr. MGR University. We are looking forward to another session with all of you, maybe after a few months, where we can interact with another set of the students who are looking forward to such kind of webinars into the areas of healthcare industry. So thank you so much.
Participants, the feedback form is posted in your chat box. Please do fill them. Thank you, ma'am.
Thank you all. It was a pleasure.
Ma'am, I thank both of you, ma'am, for your beneficial information and the clarification you have provided to our students. We'll be in touch with you, ma'am. Thank you.
Sure, definitely. It was a pleasure. Have a nice day. Thank you.
Okay.